Hey YouTube, it's your favorite girl, Shan Shan. Excuse my scarf, I'm at home. Okay, I just had to come on here for a second because y'all know I work in health insurance. I'm just venting to you all. We're really venting to myself. Okay, so here's the thing. I understand health insurance is a lot. It is a lot. Excuse me, my allergies. It's a lot to deal with. Hold on, let me get a piece of tissue. Especially when you have, ooh, my water. Complicated issues, things that have to go through referral management, supervisors, care coordinators. It can become a hassle that nobody wants to worry about if a particular office visit or if a particular stay at a facility is going to be covered when they have health insurance. Totally understand that. And I get that on a patient's aspect. However, what I do not sympathize with is when things are laid out for you, loud and clear. Just had a member daughter call me, the lady 84. She was in a hospital, went to transitional care. It's still a skilled nursing facility. Anything that's in a hospital and you got room and board, skilled nursing, rehab, whatever, has to be approved. You can't just walk into a facility, hey, can I stay here for about 30 to 40 days till I get better? And y'all give me physical therapy, speech. Can I do that? Cool. It don't work like that. Not here. I wish, but it does not. You have to get approval. First, it has to be documented that you need it. You can't just get approval. It has to be medical necessary that you need to go to this. More than likely, it's already going to be there if you were in the hospital. Like my husband, he broke his knees. From the hospital, it had to get approved that he needed physical, he needed rehab. It was clear he could not walk. Duh. I made sure everything was transferred over. I made sure the insurance was in compliance. I understood, I had confirmation because his insurance is a little different. Because it's through another party, I had to go outside of the insurance company, talk to that third party to make sure that third party was aware. They were aware, the care coordinator was aware, the social worker was aware. Understood. Okay. It's a lot of steps, but my thing is my husband broke his knees. The last thing he needs to worry about is bills. Even though he in there and he had to maneuver some shit too because I'm working, I'm at home with the kids. It's a lot. But we are a team. Anywho, moving forward. This lady, the daughter, was like, well, she has an $11,000 bill. Yes, she do. And now y'all don't want to pay it. See, I've been doing this too long. And I've been doing this too long. Now, I don't say everybody is a liar, but I know a liar when I hear one. When you stumbling and when you constantly giving me, when you don't have to lie. You got the meat and potatoes. This is it. This is why. When you coming out with other shit, with fruit and baskets and other extra shit that don't even need to be in a meal, that's when we have an issue. And so I called the facility. The facility says, excuse me, my hair itches. The facility says she knew that the health insurance was not going to cover this. They proceeded anyway, thinking that they were going to get approval through the state to get Medicaid to pay for this. No. I always tell people, you can't go based off what may happen. I already know how these facilities are. Most facilities cover themselves because they have to, or they're gonna have to eat thousands and thousands of dollars, and that's gonna fuck them over, and fuck their employees over, and fuck potential residents over. So they have to CYB. The facility said they had an admissions meeting with her, letting her know, look, if you proceed and you sign this paperwork, if this doesn't, I already know how it goes. If this doesn't go through, you're still going to be responsible. We'll take her. We'll file all the paperwork to see if it can get paid through another way. But if it can't, just keep in mind, you're going to have to pay this. Period. You're going to have to pay. And guess what? Now they have to pay. HAP did not approve it. You cannot have a skilled nursing facility without your insurance approving it. And if you do have to be due diligent. You got to be on their head. Call all day. Call every day. Don't sign no paperwork. Don't admit nobody until nothing until you get an okay. If you got to take this person home, take them home, get somebody that can take care of them, do what you can. But don't admit nobody until you get some sure answers, until you get some authorization codes, something for your records that you spoke with this person, so at least you will have that. So if they try to say, oh, I got this authorization code, I spoke to this person on this day at this time, these calls are recorded with the insurance companies, y'all need to go back and listen to them. I was told otherwise. And also record the conversations yourself. Man, I'm trying to put y'all up on game. I'm not, as an insurance person, I'm not the bad guy, but I'm always looked at as the bad guy because I have to give the bad news. Now, in some instances, which is very, very rare, people be like, you know what? I didn't like what you had to tell me, but because the way you told me and how passionate you were about it, I understand. Cool. That's all I ever wanted, was just someone to understand me and get what I'm saying. That's it. Like, my thing is, I don't want to give nobody a hard time. Of course, I want health insurance covered. I wish we had universal health care, but we don't. You know what I'm saying? It's only so much we can do. So if you know you have to have services rendered, make sure see if they need prior authorization before you get services rendered. If you don't know, ask for them billing codes, ask for them CPT codes, ask for them procedure codes. That's going to let you know. Period. Get a rapport with your insurance company. Stop calling when it's last minute when you finally need some shit. Get to know your insurance company. Really read y'all shit. And stop calling here like y'all don't. I'm not asking y'all to know everything. That's impossible because I've been here for years and I don't know everything. Because shit changes daily. Oh yes, shit changes daily behind the scenes. Little do y'all know. That's why I be trying to tell y'all, get up on y'all health insurance. Know what's covered, know what's not covered. Ask if there has been any updates with the insurance. Ask. I promise you it has been. I promise you. Like, hey, don't fall for, okay, oh, everything's fine. And you find out that your premium about to increase. Shit happens. That doesn't happen often, but it does happen. Or your doctor is no longer in network and y'all don't get a letter. We're not notified. The doctor doesn't notify us. They just say, hey, we are no longer taking this insurance no more. And then you're steady going to the doctor and now you got this $1,000 bill for all the times you've been going. But wait a minute, I thought it was covered. Oh yeah, they stopped taking us back on March 13th, 2012. Nobody told me, nobody told us neither till you got a bill. So you see what I'm saying? Do you see where I'm going with this? Health insurance is about money. They don't give a fuck about your color, but they tend to be nicer to other colors. Let's just be real there too. So, come equipped. Come equipped. Know your shit. Know your health insurance agent. If y'all are able to have a concierge, we don't have anymore. And I understand why, but if you are able to have a care coordinator for the first 2 years that you're on the insurance, that's just one selected person that helps you with everything. Get to know them. Get to know them. We deal with tens of thousands of people every day. You are just a number, literally. Get to know them. I know some of my members because they call, because they have health ailments and they need to know what the fuck is up. I get it. I'm not even mad because y'all calling keeps me employed and helps me pay for my stuff and my family stuff. So I'm not tripping. Call. I ain't doing shit but working anyway. That don't bother me. But what bothers me is when y'all don't know y'all benefits to a certain extent and when y'all come up in here trying to lie to get shit covered that y'all knew wasn't fucking covered. That's a problem for me. When y'all try to game the system. And also, at the same time, I don't even mind y'all trying to game the system, because the system is gaming everybody. But be smart about it. You can't say something was covered and it's not, and it's written in black and white, and we go send it to you in black and white that it's not. Be smart. Know your plans, people. That's it. Be blessed.